Hi everyone, it's Tiffany with Ascend Therapy, and I'm an occupational therapist and certified hand therapist. And today I wanted to talk to you about how to wear a tennis elbow strap the proper way. I have a lot of people that come into my clinic. They've been dealing with this elbow pain for at least 2-3 months, sometimes even longer. They say they've tried a tennis elbow strap that they were told to get from their doctor, and it did not work. So I always ask them to bring it in so that we can see how they're putting it on and are they putting it on correctly in order for it to do its job and decrease that pain that they're having. So I bought this one off of Amazon. I just bought the cheapest one that I could find. You can get these at Walmart, CVS, Walgreens, any pharmacy should be carrying these, it'll say elbow brace, tennis elbow, golfer's elbow strap. They all essentially do the same thing. They all have, all look about like this. Some are a little bit bigger, some are a little bit smaller, but essentially they will all have some kind of little cushion in them. Sometimes it's a gel pad, sometimes it's an air pocket, but essentially they all work the same. We just have to know how to put it on correctly. The box doesn't tell you, and there's not really any good directions on why you place it, where you place it, and how you place it there. So I wanted to run through this real quick. I could talk about tennis elbow lateral epicondylitis for over an hour. So we're just gonna keep this quick and short, sweet, to the point with just talking about the strapping. So with the tennis elbow, you will typically have pain, but with touch on this bone right here on the outside of your arm. Now that is where the extensor tendons and some of your finger extensors actually start right here at this bone. So you've got the tendon attaches the muscle to the bone, and so the purpose of this brace is to provide some compression to the muscle belly to distribute the force going to the elbow, which would help decrease pain. Putting it on the correct way. So when you first put this on, you are going to slide it onto your forearm. Here is that bone, and again, if you have tennis elbow, that's going to be very painful to the touch. You're going to want to go about 2 fingers below that, or about 1 inch, and that pad in there should go directly over the muscle belly. Now, here's where people get a little bit confused, is they just put this on, put it on as tight as they can, kind of get it there, and then they realize that actually leaving it on causes more pain. And that's because it is on too tight. So in order to get it on the right way, you are going to get it in that right position over the muscle belly. And you can see if I wiggle my fingers here, you can actually see the muscles there. So we're trying to go over that. Okay, there's that bone, 2 fingers below. Get that in place. Now, what you're gonna do is you're gonna make a tight fist. So get those muscles flexed. You're going to pull, okay, so that it's snug, like comfortably snug. When you let go, it's not gonna fall off, so it's not gonna be too loose. And then every time you go to make a fist, lift, which is when you need it, that's going to distribute the force going to that tendon where you're having all that pain. So pain, usually people say they have a pain when they're just even lifting up their cup out of the cup holder. That's a super common complaint that I hear. The same position would work for golfer's elbow. So golfer's elbow is on the inside of the elbow. You would just take that same brace. You could flip it around. Again, your epicondyle is your tendon origin, the muscle belly, right? So your muscle belly here, okay? There, same thing, you're gonna make a tight fist, pull it tight, wrap it around, okay? And again, so you should really only feel that compression when you're actually moving and using your arm, gripping, twisting, lifting, anything like that. So, take that off here. If I show you on my arm here, this is an example outside of the arm, those muscles coming all the way here. That tendon origin is right here. And so you're basically putting that brace right over top of that muscle belly, okay? I've had patients go from squeezing only 20 pounds with significant pain. When we put this on in the right spot, they were able to get up to 60 pounds with less pain. So it is effective if you get it in the right spot. Now, if you feel like this isn't helping, my recommendation is to like, let's say that you're having some shooting pain coming down into the arm. It may be that you're having a little bit too much pressure over your radial nerve coming right through that spot. So in that case, I would recommend wearing a wrist cock-up brace, which is the same thing as what you think of as a carpal tunnel splint. And so that will put your wrist in a little bit of a neutral position. And by doing that, you've got that muscle tendon group on a little bit of like a resting position. Then you also have that nerve on a little bit of a slack, and so that can also help calm down some of that pain. And so either one of those is fine. It's just based off your preference. The nice thing about the counterforce brace is it doesn't restrict motion. You can use your arm as much as possible. With the wrist brace, you do lose the wrist motion, so I would want you taking it on and off just to make sure you're moving the wrist around. You don't need to sleep in it, because again, it's only being effective when you're using your arm, and when you're sleeping, hopefully you're not using your arm too much. So yeah, don't wear it when you're sleeping. If you're one of those people that right now you're having just so much pain all the time, I recommend wearing it pretty much all day long, and then you're gradually going to wean out of it as your pain starts to subside. So maybe going from wearing it all day to just wearing it with like just resisted activities. So some of your work tasks, yard work, sweeping, mopping, raking coming up here soon. So I would wear it for those things, and you're just gradually going to wean out of it. There's lots of other things you can do for tennis elbow. There's lots of other muscles that can be strengthened and worked on, but that's going to come from your therapist is going to give you the best evaluation of that and what your needs are. But if you're just looking for, let's just try this strap out, that's how you put it on, and hopefully that video helps. Hope you have a good day. Thanks.